Hello and welcome to a module created by the HDRN Pragmatic Trials Training Program. Pragmatic clinical trials are conducted in routine healthcare settings, which can blur the line between research and usual care. This raises some unique ethical questions. However, the fundamental ethical principles that guide all clinical research remain the same.
That is exactly right, Liam. Even though pragmatic trials operate in usual care environments and bring some unique challenges, we still have to uphold all ethical principles to protect participants and maintain research integrity. In this session, we'll explore how beneficence, respect for persons, and justice form the foundation of all clinical trials.
Let's start with beneficence, the principle of doing good and avoiding harm. In a pragmatic trial, we're usually comparing interventions that are already considered part of usual care, so we're not giving anyone a completely unproven or unsafe treatment. Even so, we continuously ask ourselves, are we minimizing potential harms? Are we monitoring outcomes so we can catch any issues early? We need to be vigilant that neither the trial itself nor the treatment protocols being compared expose participants to undue risk. The goal is to maximize the overall benefit of the research, generating better evidence for patient care without needlessly exposing anyone to harm.
Next, the principle of respecting the autonomy and dignity of participants. In traditional trials, this usually involves a thorough informed consent process, strict privacy protections, and a clear separation between research activities and regular patient care. In pragmatic trials, research is woven into routine care, so the lines can blur. This makes respecting autonomy trickier, but no less important. We might need to use creative consent approaches or broader notification strategies to inform patients that a study is happening. The key is that participants deserve to understand what's going on and to make choices when possible. We still protect their privacy and make sure they know that their participation in any research aspect is voluntary. As researchers, we can't lose sight of individuals' rights and values.
The third principle is justice, which is all about considering fairness in several dimensions. First, fair selection of participants. We should recruit a diverse range of participants without exploiting vulnerable populations and without unfairly excluding groups who might benefit. Second, equitable distribution of burdens and benefits. We need to distribute the tasks, risks, and benefits of the research fairly across sites and participant groups. Similarly, no single group should bear all the risks while others reap the benefits. Third, shared benefits. The results of the trial, such as improved care practices, should ideally benefit all partners, especially the communities and healthcare systems involved. And fourth, community impact. We need to consider how implementing the trial might affect different communities or clinics. We strive to ensure that the trial doesn't inadvertently favor well-resourced settings while putting undue strain on less resourced ones. Now, let's shift to a key ethical questions we face when designing a trial: clinical equipoise. Angela, would you like to discuss that?
Absolutely. One cornerstone of ethical trials is clinical equipoise, or the genuine uncertainty in the expert medical community about which intervention is superior. In this module, we purposely differentiate between usual care and standard care. Usual care is what patients typically receive in routine practice and can vary by site, while standard care refers to guideline-recommended or widely accepted best practice. As mentioned earlier, pragmatic trials generally compare interventions that are already used in routine practice. But often, the community of experts isn't sure which of those works best, and that's why the trial is needed. Equipoise provides the ethical foundation to even start a trial. That said, individual providers often have their own preferences based on experience.
To illustrate a simplified example of a challenge of provider preferences, imagine a pragmatic trial comparing two common blood pressure medications. The wider medical community truly doesn't know which medication leads to better long-term outcomes. But Dr. Smith at one clinic has prescribed medication A for 20 years and strongly believes it's the best for his patients. Meanwhile, in another town, Dr. Jones prefers medication B for her patients based on her own experience. Both A and B are standard treatments, part of usual care, but these personal preferences set the stage for a dilemma.
Maintaining equipoise in the face of such preferences isn't just a theoretical concern. We have to manage it actively. There are several strategies we can use to help healthcare providers remain comfortable with the trial. First, engage providers early in the design. Let them voice concerns or biases before the trial starts. If they feel heard and can contribute to the study design, they are more likely to trust the process. Early engagement also allows us to address misconceptions and incorporate frontline perspectives that improve the study. Second, giving providers concrete information is key. Present data from past studies or guidelines that demonstrate why there's equipoise. By laying out the evidence, we reinforce that neither option is a clear winner at this point. Third, discuss how the trial might build flexibility, allowing for clinical judgment. For example, if a provider feels strongly that a particular patient might benefit or be harmed by a treatment, the trial protocol would allow that patient to be excluded or to cross over to the other arm. Finally, provide training and education for participating sites or providers to showcase that both treatments being studied are considered good options. Given all this, how do we keep a rigorous, ongoing risk-benefit assessment at the center of pragmatic trials without undermining their pragmatism?
That's a great question. I think it comes down to this. Every clinical trial, whether pragmatic or not, requires a careful risk-benefit assessment. We need to weigh the potential harms against the potential benefits. Like we've said a few times, pragmatic trials are conducted in the wild, so to speak, so researchers don't control every detail of what's happening. With that, the context or local environments where the trial takes place can influence risks and benefits in ways that a traditional, tightly controlled trial might not experience. With that, there may be subtle risks or unintended consequences that appear when implementing a new treatment protocol on a large scale. We will explore these and other considerations in future modules.
As we wrap up, the main takeaways from this module are that principles of respect for persons, beneficence, and justice guide everything we do. These principles don't limit pragmatism, they strengthen it, ensuring that our trials truly serve patients, providers, and communities alike.
Thank you for joining us. We hope it gave you new insights into the ethical foundations of pragmatic research. Don't forget to subscribe to our channel and hit the bell icon to stay notified about upcoming modules.
Bye, everyone.